Combat medics and other medical personnel are accustomed to providing medical aid to the wounded. Sometimes the wounded are military working dogs. That's why Captain Vivian Holt and her staff are teaching over 300 medical personnel from the U.S. Army, Navy, and Air Force, along with several NATO partners, about the importance of tactical combat casualty care for military working dogs as part of Joint Emergency Medicine Exercise 2024.
In the setting abroad, when they are deployed down range, they're not always going to have a veterinarian nearby. Normally, veterinarians are back at Role 3 setting, so more in the hospital setting. There are going to be some in more of a Role 2 setting as well. However, where the dogs are going to need true care, the most emergent care, it's going to be human medical providers that provide it.
Working with dogs comes with many challenges.
The first step is actually not for the dog, it's more for your safety.
With these dogs, they always need to keep in mind that these dogs can bite, and they will bite, and they are trained to bite. Even if they're just for explosives or drug detection, a lot of them have been trained to bite.
Yeah, it's going to be a challenge for sure. A lot of things are different. They're basically like drug addicts. The doses they need for opioids is insane. So there's a lot of physiologic differences.
But challenges also represent opportunities.
We don't get a whole lot of training with animals, so we've done this once before, but it's good to get a refresher before going out and potentially actually dealing with the animals in the real world. So,
medical personnel don't get to decide who gets injured and who doesn't. Sometimes the injured are military working dogs who are entitled to just as much medical care as humans. For these medical personnel, learning how to provide medical care to military working dogs during JEMX 2024 will give them the knowledge to do so in the future if the need should ever arise. Frank Minnie, Cardamsey Public Affairs.